It's no secret that vitamin B1 is crucial for many neurological functions in both the body and the brain. But here's a lesser known fact. There are two different forms of B1. One of these forms is imperative for anyone who has prediabetes or diabetes, and this same form is the only type of B1 that can prevent the development and the progression of peripheral neuropathy. In this video, I'll review the two different forms of B1 and how they differ. I'll reveal which form every diabetic should be taking and which form is critical for nerve repair. Coming up. Hi gang, I'm Dr. Valerie Montero, leading expert in peripheral neuropathy and more importantly on how to overcome it. My mission is to empower each and every one of you with the information you need to get back on the road to recovery from peripheral neuropathy and to be able to start living life again. If you're new to my channel, click on that subscribe button and also on the bell so that you can get notified as soon as I publish new content. Today, I'm going to cover the importance of B1. I'll explain why this vitamin is absolutely necessary for anyone that has prediabetes, diabetes, heart disease, or peripheral neuropathy. Make sure you watch this video until the end because I'm going to tell you exactly which form of B1 you need because remember, there are two different forms, and at the end of this video, I'll tell you exactly how to take it. So let's get started. First of all, why do we need B1? Well, vitamin B1 is essential for converting carbohydrates into energy, so it's necessary for mitochondrial function. But there's another reason it's important, and that's to maintain the nerve tissue of the brain and the peripheral nervous system, as well as maintaining the integrity of the blood vessels of the heart. As I mentioned earlier, vitamin B1 can exist in two different forms. One form, known as thiamin, is water-soluble, and this is the one you'll commonly see in a B-complex vitamin. The second type of B1, known as benfotiamine, is fat-soluble. Now, thiamin is naturally occurring in many foods, such as organ meats like liver. You can also find significant levels of it in wild-caught salmon. However, farm-raised salmon has much lower levels. Other foods rich in thiamin are clams, mussels, flax seeds, nuts, fruits, squash, asparagus, beans, green peas, brown rice, and brewer's yeast. But here's a scary fact. Thiamin listed on supplement labels doesn't actually come from any of the whole foods that I just mentioned. In fact, most thiamin found in supplements comes from China, where it is derived from toxic substances like coal tar, ammonia, and acetone. Now, doesn't that sound wonderful? This is not made up, folks. This is absolutely true. So let's talk about benfotiamine. This form of B1 is synthetic, and normally you'll always hear me say to stay away from synthetic supplements. However, this is the one exception to the rule. Benfotiamine is very safe with no side effects, and better yet, it has far better absorption into nerve cells than thiamin. I'll get deeper into that in just a moment. Now, let's talk about the relationship that these two B vitamins have with each other. Benfotiamine is the precursor to thiamin. This means when you take a benfotiamine supplement, it'll convert to thiamin inside of the cells. So the question you might be asking yourself is, why not just take a thiamin supplement to begin with? Well, remember I said earlier that thiamin is water-soluble? Well, this poses a big problem when you're trying to get vitamin B1 into your nerves. The protective outer layer of the nerves are made up of fat. Because thiamin is water-soluble, it can't effectively penetrate into the peripheral nerves due to this fatty outer layer. On the other hand, benfotiamine is fat-soluble, so it can easily pass into the nerves and penetrate very deeply. As a matter of fact, benfotiamine has an absorption rate into nerve cells that's 3 to 5 times higher than that of a thiamin supplement. Once inside the cell, the body will then convert benfotiamine to its natural counterpart, thiamin. This allows higher levels of thiamin to be utilized by your nerve cells and many other cells that rely upon it. Next, let's talk about how benfotiamine helps repair peripheral nerve damage. Benfotiamine will prevent and block oxidative stress leading to the damage of the nerves. So the main question is, what drives this oxidative stress that causes nerve damage? Well, here are some of the main driving factors. The first one is elevated glucose, and this can be from prediabetes, and that's when your fasting sugar levels will range between 100 to 125 milligrams per deciliter. Or it can certainly happen with full-blown diabetes, and this is when your fasting glucose is at 126 milligrams per deciliter or higher. Now, when you have high amounts of glucose in the body, it causes huge amounts of oxidative damage to the cells, and the nerve tissue is highly susceptible to this damage, which can result in its breakdown. But I want to be clear. Both benfotiamine and thiamin will decrease oxidation. However, benfotiamine takes it a step further. Benfotiamine has the unique ability to block the formation of AGEs, or advanced glycation end products. AGEs are formed when you combine glucose or sugar with a protein or with a fat, and then you expose it to heat. This creates these sticky proteins known as AGEs. So, for instance, let's say you take some ribs and you cover them with barbecue sauce, which, by the way, is loaded with sugar. Then you throw them on a grill to cook. You've just taken a protein and slathered it with a sugary sauce and set it on fire, or exposed it to very high temperatures. These delicious ribs you may love to eat are now loaded with AGEs, leading to greater oxidation and potential nerve damage. Now, let me take just a minute to further blow your mind. Did you realize that ice cream is loaded with AGEs? What? Well, we all know that ice cream contains a lot of sugar. Then you have the milk protein and fat. But where does the heat come in? Well, here's what I never stop to think about. All ice cream is pasteurized. This means it's exposed to heat for at least 30 minutes. Bam! There are your AGEs. The problem is these sticky proteins cause major damage to your peripheral nerves, your eyes, your arteries, and your brain, the other nerve tissue, remember? Now, here's where it gets interesting. Benfotiamine is the only form of B1 that can help reduce these AGEs. Thiamin doesn't have this ability. And here's another bonus. Benfotiamine also helps your cells become more sensitive to insulin, which will decrease your level of hemoglobin A1C. This is extremely important not just for diabetics, but really for anyone eating a standard American diet. This is a diet that's low in fiber, low in fruits and vegetables, and very high in saturated and hydrogenated fats and sugar. Also, you've probably never been told that the higher your blood sugar levels are, the more depleted your vitamin B1 levels will become. These are all reasons why anyone with elevated glucose levels should be taking benfotiamine. But even if your blood glucose levels are perfectly healthy, you may still be experiencing oxidative stress leading to peripheral neuropathy from other things like pharmaceutical drugs. Now, I'll leave you a link in the description box below with a list of the many medications that can cause this. Also, chronic exposure to ordinary environmental chemicals can lead to this type of damage. So we're talking about chemicals like cigarette smoke, lawn and garden chemicals, chemicals sprayed on farm crops that you eat, household cleaning chemicals, insecticides used inside your home or outside your home, and also insecticides that you spray or rub directly into your skin. And this list goes on. I could do an entire video just based on this topic alone and how it affects our health. Now, the next thing that's important for you to know are the causes of B1 deficiencies, which will result in oxidative damage leading to peripheral nerve damage. So we're going to start with a diet consisting mainly of white flour, wheat flour, white sugar, and white rice. By the way, This will also cause B6 and B12 deficiencies, which are also critical for the health of your peripheral nerves. Other things that can lead to this damage are carbohydrate-dominant diets. Also, things called sulfites. Sulfite consumption, this is a preservative used in sandwich meats and in red wine, can lead to this type of damage. Excessive consumption of coffee and black teas. Also, chronic alcohol consumption. And I'm not just talking about alcoholism. I'm talking about regular alcohol intake. If you want to find out how much alcohol you can safely drink, watch my video on alcohol and neuropathy. You can click on the banner in the corner with the eye on it, and it will take you directly to the video. Other things still are gastric bypass surgery that can cause a B vitamin deficiency. Irritable bowel diseases, Crohn's, and ulcerative colitis, which are inflammatory bowel diseases, can lead to B1 deficiencies, and diuretic medications. These are usually prescribed for high blood pressure and fluid retention. Also, this may surprise you, but pregnancy and lactation can lead to B1 deficiencies. Also, diabetes and prediabetes, kidney dialysis, and hyperthyroidism. Now, let's discuss some of the amazing benefits that you'll experience by taking Benfotiamine. Clinical studies have proven that Benfotiamine can decrease nerve pain, assist in peripheral nerve repair, improve numbness in the feet or legs or the hands or arms, improve the speed of nerve conduction. That's how fast a signal will travel up and down the nerve. It can also improve insulin sensitivity, reducing your hemoglobin A1C levels. Benfotiamine can protect the kidneys from elevated glucose, protect the eyes from elevated glucose, and improve diabetic retinopathy. And it can also increase your natural thiamin levels, as we mentioned earlier. Benfotiamine does a phenomenal job at decreasing inflammation in brain cells, and it protects the brain against dementia and also Alzheimer's. It improves circulation and blood vessel health. Now, this is important for people with heart disease as well as those suffering with peripheral neuropathy, because the peripheral nerves deeply rely upon healthy blood vessels and good circulation in order to get oxygen and other nutrients to the nerves for repair and regeneration. And lastly, Benfotiamine reduces alcohol cravings. And here's the question you've been waiting for me to answer. So, how much Benfotiamine do you need to take to get all of these benefits? Well, research shows that you should take between 500 to 600 milligrams per day. But it's best if you spread it on out throughout the day. So it would be best to take 250 milligrams to 300 milligrams twice a day. Studies have shown that 70% of neuropathy patients taking Benfotiamine will have a significant reduction in their symptoms. Also, taking Benfotiamine with methylcobalamin B12, pyridoxal 5-phosphate B6, along with our alpha-lipoic acid and acetyl-L-carnitine will have an even larger impact on protecting your nerves and improving your recovery from peripheral neuropathy. Today, I'm going to talk about an antioxidant that's gained a lot of attention in recent years, alpha-lipoic acid, or ALA. And I'll uncover the ALA scam that's going on. So before you rush out to spend your hard-earned money on this product for your nerves, you need to know these important things. First, let me begin by explaining what alpha-lipoic acid is. It's an antioxidant made by your body and found in every single cell. Its job is to help turn glucose into energy. But this isn't the only function of ALA. There are many others. Other important functions are alpha-lipoic acid aids in nerve repair and protects nerve cells from further damage. It helps peripheral nerve regeneration, meaning it assists the damaged peripheral nerves to grow new nerve endings and nerve fibers. It improves nerve communication. It decreases the symptoms of neuropathy like the pain, the burning, tingling, and the numbness. And ALA decreases inflammation. It also enables proper signaling and stimulation of muscle fibers. It helps absorb B vitamins, and we already know our nerves depend upon B1, B6, B12, and folate for their health. It decreases elevated glucose levels and improves insulin sensitivity. And it can help transport glucose into the cells in the absence of insulin. So, We can clearly see why this antioxidant has received so much attention for peripheral neuropathy cases. Now, here's where you need to pay attention. Alpha-lipoic acid exists in 3 different forms, but only one form is effective. Before I review these forms, I want to let you know that I'm offering my ebook, The Great Neuropathy Hoax, as a gift for anyone watching today. This ebook will truly help you understand your neuropathy and how you can recover from it. I'll leave the link in the description box below so you can download it after watching this video. Now, let's take a look at the 3 various forms. There is R-alpha-lipoic acid, S-alpha-lipoic acid, and RS-alpha-lipoic acid. The only form that is effective is R-alpha-lipoic acid. This form is biologically active and exists in the natural form that you may find in your body or you can find in food. This is the exact type of ALA that our body makes and requires. It's 12 times as potent as S-alpha-lipoic acid and RS-alpha-lipoic acid, and it's both water and fat soluble. This means that it can get into any and all cells, unlike other antioxidants like vitamin E, which can only get into fat-soluble cells, or vitamin C, which can only get into water-soluble cells. R-alpha-lipoic acid is the only form that anyone should take. Otherwise, you're just wasting your money. You'll know this is the right form because on the supplement facts panel, where all of the ingredients are listed, it will show R-alpha-lipoic acid. So let's take a look at why S-alpha-lipoic acid and RS-alpha-lipoic acid are not effective. What's the difference between these two? Well, S-alpha-lipoic acid is synthetically made. It's chemically manufactured in an inactive state. This means it's not in a usable form for the body. Because of this, the body has difficulty absorbing this form of ALA. Also, S-alpha-lipoic acid can inhibit the absorption for the correct form, the R-ALA, into nerve cells. I'll explain why it's important to know this in just a minute. RS-alpha-lipoic acid is actually a 50-50 mixture of the natural R-ALA and the synthetic S-alpha-lipoic acid. So you might be thinking, well, that's not bad because at least it's a lot cheaper and I'm getting some of the natural R-alpha-lipoic acid. Think again. Remember just a minute ago I said that the S form of ALA can inhibit the absorption of the R form? Well, when you mix the two together, the S form will deactivate the good R-ALA and it will prevent it from being absorbed into nerve cells. The scam comes in because nerve support formula companies will use these inferior, ineffective forms and market it as simply alpha-lipoic acid. The unknowing consumer purchases it thinking they're getting a heck of a deal because it's so cheap and they're getting all of the amazing benefits. When in reality, the unknowing consumer just wasted their money on junk. So, how will you know if your alpha-lipoic acid is junk or not? When you look at the supplement facts panel on the back of your bottle, if the ingredient label simply states alpha-lipoic acid without the letter R in front of it, it will always be the synthetic version, either the S or the RS-ALA. Now, here's something else you need to be aware of. Some companies are beginning to use a small amount of R-alpha-lipoic acid, the good biologically active form, but then they add in the S form of ALA. Well, remember that the S, the synthetic form, will limit or prevent the good R-alpha-lipoic acid from being absorbed or utilized by the body. Here's another part of the scam. The companies that are mixing R-ALA to the synthetic alpha-lipoic acid are marketing it as R-alpha-lipoic acid, the natural better form, when it's not. In fact, this form may only minimally help your nerves or may not work at all. These companies intentionally market it this way because people are getting smarter and they're demanding the correct form. So the nerve support formula manufacturers want the customer to think they're getting the very best version at a dirt cheap price. I can guarantee you that if you're paying less than $50 for a 1-month supply of a nerve support formula, you're not getting a good product. I know this because I know exactly how much the pure quality ingredients cost, and there isn't a company that can manufacture the purest, highest quality ingredients at therapeutic doses as established by the clinical studies for less than $50 for a 1-month supply. So here's the takeaway. Only buy nerve support formulas that list R-alpha-lipoic acid in the ingredient portion of the supplement facts panel, not on the front of the bottle. They can put whatever name they want on the front of the bottle. 2, do not buy a nerve support formula that has both R and S ALA, because the S form will prevent absorption of the good R form. Do not buy a nerve support formula that only lists alpha-lipoic acid without the letter R in front of it. This means you will be buying the synthetic version in the S or the RS form. Be wary of any nerve support formula that's being sold for under $45. This usually means they're using poor synthetic ingredients, or they're using dosages that are much lower than the therapeutic dose that are set forth by the clinical studies to repair peripheral nerves and that have shown to be effective. Any company that strives for quality will pay more money to produce their formula with only the R-alpha-lipoic acid version. The nerve support supplement will cost more, but that's because you're getting the best quality ingredients at the appropriate dose. Now, I want to hear from you. Did you know that R-alpha-lipoic acid was the only effective form to repair peripheral nerve damage? Leave me a comment in the description box below and tell me if this surprised you. Here's an important tip. Research shows for effective nerve repair, a person should consume 600 milligrams of R-alpha-lipoic acid daily. In Neuriva CM Gold, we never use synthetic ALA. You will always see R-alpha-lipoic acid at the therapeutic dose on our ingredient label. That means when a person takes the recommended dose, which is 2 capsules twice a day, they're getting 600 milligrams of R-ALA. If you'd like to learn more about Neuriva CM Gold, just click on the link below to visit our website. Now that you're informed, you can avoid the alpha-lipoic acid scam. For more eye-opening information on peripheral neuropathy and what you can do to take control, click here to subscribe to my YouTube channel or head over to our website for up-to-date blogs, information, and real patient testimonials. I want you to experience the very best in your health journey. Blessings.